The secret most people don't know about ICU, that recovery of an ICU patient starts from day one. Let me ask you a question. When you picture a typical ICU patient, like the ones that have a lot of things connected on their body, what comes to your mind? Ventilator, sedation, coma, life support, machine is breathing for him, and all that, right? But here is something that will surprise you. Even many nurses, many doctors, other healthcare workers that are not working in the ICU, the work of getting that patient home safely starts from the very first day the patient enters the ICU, not when they are transferred from the ward, not when they are discharged. Hello everyone, I am Nurse Vina here. I've been an ICU nurse for more than 7 years, and I'm here to take you through ICU recovery, or what is called ICU rehabilitation. And this is my YouTube page, and I want you to subscribe to my YouTube channel, please. Thank you. So let's start. ICU rehabilitation. Once you understand this, you will never look at ICU patient the same way you look at them. So just sit tight where I try to summarize this for you. There are teams that are responsible for this achievement. Whether you're a nurse student, healthcare worker, or someone who has ever had a loved one in the ICU, this video is for you. By the end of this 4 minutes, you will understand why ICU recovery is so much more than keeping someone alive. There is more to recovery than just breathing. Now, I remember when I first started working in ICU, I thought rehabilitation happens after patient is being discharged, after patient is stabilized from the ICU. I thought physiotherapy starts in the ward. I thought once someone survived ICU, the difficult part was over. I couldn't even be more wrong. Did you know that after just a few days in bed, patient can lose significant muscle strength? Some will wake up unable to sit down, unable to stand, unable to swallow, unable to stand, unable to do anything. Some will even struggle to remember their name. They will struggle to speak and struggle to remember who they are. That is why ICU rehabilitation begins immediately. Now, let's go to the part 2. What really happens in ICU? Many people think ICU doctors and nurses work alone. No. Actually, we have a lot of fantastic other team behind the scene. Recovery is one of the greatest and the biggest efforts, the greatest and the biggest team effort in the hospital. Now, the ICU doctor, they fight the illness, they keep the patient medically stable and try to take him out of danger. Fine. Now, the doctors, the nurses, they are there every second, every minute, every hour of the day to make sure they prevent pressure injury, helping patients move safely, manage pain, reduce delirium, and encouraging recovery long before even the patient can walk. We also have the physiotherapists. Sometimes their biggest achievement is not just about getting the patient to walk again. It is even helping them to sit at the edge of the bed for the very first time. They also do what we call the chest physio, making sure their lung is healthy enough to survive the ventilator and be able to wean out of ventilator on time. We also have the occupational therapists. This team, this fantastic team, they help patients regain everyday life, just like holding the spoon, holding the mug, brushing their teeth, getting dressed, just simple things that you take for granted. This is where occupational therapists come in. It's more like reintegrating them into a daily activity of life. Now we have the speech and language therapists. I'm sure some of you have not heard about this name. Many ICU patients cannot swallow safely after ventilation. So this team helps them to eat, drink, and communicate again. We also have the dietitians. Without proper nutrition, the body cannot rebuild, muscle, or heal. So the nutrition is being regulated and monitored by the dietitian on a daily basis. Now we have the clinical psychologist. ICU does not leave only physical scar. It leaves a lot of mental and emotional and psychological scar. So this is where the clinical psychologists come in. Many survivors experience anxiety, depression, or even PTSD. Healing the mind is just as important as healing the body. This is my favorite way to explain ICU rehabilitation. The patient may still be critically ill, yes, but we are preventing complications before they happen by positioning, passive exercise, pain control, nutrition, and delirium prevention. I will talk about this individually in my next videos, so just stick to my channel and I'm going to post it for you. So it's happened in stage by stage. So in the first stage where you try to prevent complication, in the second stage, maybe the patient has started sitting up, practicing breathing, learning to swallow again safely, learning how to communicate again. Then after you have achieved that, you move to the next stage. The patient may be standing again, taking their first few steps, washing themselves, eating independently, and preparing to leave the ICU. When this has been achieved, it moves you to the next stage, the stage 4. And this part surprises many people. Recovery does not stop when the patient leaves the hospital. Many continue rehabilitation for weeks, even months before returning to their normal life. Family have more power than they think. If you have ever had a loved one in the ICU, you will relate to what I'm talking about. Yeah, sometime I want you to know you are not just a visitor. You are part of the rehabilitation team, talking to your loved ones, holding their hands, playing their favorite music, encouraging them during recovery. Those moments matter more than you can ever realize. So the next time someone say the patient survived ICU, remember, survival isn't the finish line, recovery is. And recovery starts from the very first day. If this video taught you something, please like, subscribe, share it with another healthcare who doesn't really know what is going on in the ICU, or with a family member who has been with their loved ones in the ICU or have their loved ones currently in this ICU. Now, I want to hear from you in the comment section. Before today, do you know about rehabilitation and how it begins on day 1 in the ICU? I'll meet you in the comment section. Thank you for watching.